of the C-CDA Rendering Tool Challenge. And again, I am David Hamill, the Director of the Project Management Office at HL7. And along with me is Steve Posnick, who is with the Office of the National Coordinator as the Director of the Office of Standards and Technology. Today, we will be going over the Rendering Tool Challenge background and an overview of it, how to enter your intent to submit, and how to actually enter your tool, the judges and the evaluation criteria, some timelines and milestones, and we also will have questions and answers. And regarding questions, if you have one, you can type it into the comment box and I will address them appropriately, or you can raise your hand and I will see that your hand is raised within the GoToWebinar window, and I will unmute you to ask the question. So we can move along here. Steve, why don't you go ahead and give us some information about the background and overview of the challenge.
Sure, thanks a lot, Dave, and very appreciative for everyone setting aside some time today to come listen to us talk to you about this challenge. It's a great example of this new partnership that we formed with HL7 this past year, and this one and this work stream that we've got underneath the cooperative agreement is both the sexy and energizing component that we think is an interesting approach that we can take perhaps with future activities, as well as we look at other areas in the standards portfolio that HL7 has. So if you've gotten a chance to go to the main challenge page, you've noticed that we framed some of the challenges that have been expressed to us by stakeholders related to the C-CDA. There's frustration by clinical users about the C-CDA. There's difficulties associated with finding relevant clinical information, and often, and this gets represented in a variety of different types of ways, but the C-CDA is described as being hundreds of pages long. I think that goes back to point number 2 on the slide about the ability to find relevant information, and probably rolling up back to number 1, that leads to an overall frustration by people using these the actual C-CDA. So I think we could probably go on to the next slide as a segue here. I'm assuming you're in control. All right, there you go. Thanks. So the challenge to you all and our discussions with Dave and others at HL7 was, let's do something creative. Let's go to the community and say, here's the problem. Here's the feedback that we received from the field. What can we do to have people do a double take, essentially, and say, wait, this came from a C-CDA? And what can we do to stimulate a different way to think about how to represent that data, how to harness the data that's already structured in the C-CDA and present it in a quick manner, in a clear manner, give the ability to access relevant data in a more efficient way, and to really make people look at C-CDA again with a fresh set of eyes, to really recognize the importance and again, for lack of a better word, the kind of power that it can bring to the health information exchange and its use as a standard to move summary care record information. So that's a little bit of the oomph and the chutzpah behind this activity. We're excited about it. It's a kind of new and creative approach that we're trying to use with our partners at HL7 to focus more attention on C-CDA and the user experience associated with it. And like I said, very appreciative of everyone's time joining the call today. Best of luck in the challenge if you decide to toss your experience into the ring. And look forward to seeing the submissions, because I think you're really going to knock it out of the park and wow us with what you've got. And I think it'll be really valuable and really impactful, and something that we will be emphasizing in the public opportunities that we have in to make the experience associated with the standards that you all work so hard on.
We have had a great response already of people who intend to participate. So thank you for everybody who's already submitted an intent. And what we'll do next is we will go through the web page that we have built up here. So let me just switch to that just a second. Doesn't seem to like to stay there. Come on.
David, Steve?
Yes.
Were you waiting for me to?
Nope. I'm trying to get it over to the web page here, and we're stuck on the slide. Just one moment.
Okay. I just heard the ominous silence.
Yeah, I know. Something went up here.
And for the record, and to entertain everyone else, I went to put my phone on mute and hung up.
So the next tool we'll have to do is a PowerPoint slide presentation that seems to work with two monitors here. So come on. I know you saw the website for a moment here. Here we go. So some of you may be familiar with this website. Others, this might be new to you. We actually did have one question that came in already. Will this slide presentation and will this webinar be available to view? It certainly will. We'll put it right out here on this website. So you can get to that website once I get back. All right, you can get to this website from our homepage. It's linked through one of the scrolling images that is on our homepage. And there's basically three main sections to the website: how to enter the challenge, some FAQs that have been brought forward, the rules of the challenge, and the judging criteria. So as I page through this, the first couple of sections, the problem and the challenge, was presented by Steve here. We also have some guidelines that is some helpful information to everyone for what they should be thinking about with when they develop their challenge. There's some helpful resources here at the bottom for CDA information. And then the green button here is your intent to submit a challenge, or an intent to submit a tool. And so, like I said, we've had quite a few people provide that to us. The second area that is on the website is how to enter. So there's basically 4 steps in entering. The first is to attend this webinar to gather some more information. The second is for those that are not in-depth in HL7, we have a content resource system that's called GForge. And this is the place where you will submit some information to us, and that's where it will reside. So if you don't already have a GForge account, you can use this link here to sign up for one, and then an HL7 staff member, our GForge administrator, will create a project for you to place your information on GForge, and we will be sending everybody who has an intent to submit some additional information on how to do that. The third item here is declare your intent to participate, as we've already said, and that deadline is April 30th. and then complete all your submissions by May 31st. Now, when you actually go on the GForge site, you're going to provide 4 pieces of information by May 31st. And I have brought up the template here. And so this is the GForge site. Some of you already are familiar with this. The area we're particularly in is in the tracker. And again, we will send you information on how to get to this particular area. But it's basically, here are your 4 pieces of information. We will have trackers, which are just kind of like action items that you will complete with the information as the description shows here. So at one point, you'll give us the URL to your GitHub repository. You'll give us a URL to the YouTube video demo of your tool. And we do have the limitation here of 5 minutes or less. You'll submit your slide presentation PDF containing any technical specifications and other information for your tool. And then the name of your tool. And so, be sure to label your tool. So that is what we're looking for a submission into the challenge. So also with this, we have a submission requirements checklist. Be sure to test your tool against sample test data. I got a lot of questions when we first sent out the announcement here about, are we going to provide some test data? We certainly have here, so this is linked to the test data. And then a few other items here are some of the requirements as well. The next section of the web page is the FAQ section, and this is based on questions that people have sent me, and I have reviewed those questions with the project team and come up with the answers here. So we're being very transparent and open about the communication with the challenge. So always, hop back to this website to find out any other additional information, especially this FAQ section, because it could grow as time goes on. We have our official rules section here. I didn't want to highlight anything there. I think everybody can review it. And then the last section is our judging criteria and judges. So the criteria for the tools will be 4 main parts: functionality, usability, innovativeness, and graphical attractiveness of the tool. These 4 aspects will be judged, and the panel of judges here is on the left. We just completed the panel yesterday, and so we feel we have a strong team of HL7 C-CDA experts, healthcare IT executives, practicing physicians, and practicing nurses, as well as web developer graphic design expertise here. So as you can see, many of you may know Calvin Beebe, who is a co-chair of structured documents. We also have Gay Dolan, who's active in HL7 International and is a practicing nurse. We have some IT executives, including Carl Dvorak and Dave McCallie of Cerner here. Emma Jones is also a practicing nurse. We have, thanks to Dr. Tom Mason of the Office of National Coordinator, he joined the judging panel. And then we have an acting physician of Larry McKnight from Cerner, as well as our own web developer at HL7, Laura Mitter, on the team. So I'm hoping we can get to the milestones, and for whatever reason, my PowerPoint actually closed, so I will just touch on the milestones here. As I said, April 30th was the date to submit your intent to participate, and May 31st was the deadline for the tool submission. We're going to announce the winners during our 30th plenary meeting in Baltimore, Maryland, our working group meeting in Baltimore, Maryland. So that is September 18th to 23rd. We have the prizes are: first place will be $15,000, second place will be $5,000, and we actually will be in contact with those winners to put the tool up on the website, make it available for people to use, and we'll be promoting that. So if you have any questions, you definitely can email myself, and I am at pmo@hl7.org. So if you have any questions, or you need to be, you're having trouble with GForge or anything like that, please let me know. So I see there are some questions here. I was going to go through them. So how can we keep the YouTube video private during submission to protect while others are still working on their entries? Great question. I'm not sure of the answer right now, but what I will do is I'll ask the project team this question, because one of the members of the team is actually Adam Wong, who is with the ONC, and he is kind of their challenge guru. So he may have some good suggestions on what we should do with that. So we would definitely want to keep that private there. Can you comment on the plans for what will happen with the submitted viewers after the competition is completed? So we have plans, obviously, for the winner and the second place person, but the others, I'm not sure what we will do with those. I will ask the project team. I'm not sure if we just, well, we can keep them on GForge, and if we feel we need to reach out to the person to see if we can use theirs for something, we could do that. But I will find out from the project team. And as I say, whenever I say I'll find it out from the project team, I'll update the FAQ section. Is there any requirement that it has to be a web or desktop application, or is it up to the team developing it? I would say it would be up to the team developing it. It has to be open source, but I'm not sure if you're saying would it be an app that would go on a smartphone or something like that. I know our target has really been a web application that we can link from our home page. We already went through that one about the YouTube video being private. And so what are we competing for? Is the best style sheet? No, I wouldn't say that. It has to be a combination of those 4 areas of judging, which were, and I was going to go back to that just to reiterate: functionality, usability, innovativeness, and graphical attractiveness. So the innovativeness criteria would state that it's more than what you're just asking there about, just the best style sheet. Is there a requirement to render from the narrative blocks or the structured entries? I will definitely take this question to the project team, because I am not the best one to answer that. So, so must the tool run on any specific operating system? We discussed that in the past, and no, I don't believe we need to. I will take that to the project team and create an FAQ for that based on their input. Is there an assumption that the inputs for rendering are well-formed CDA compliant artifacts? So no, they wouldn't be well-formed. There could be, the data could be riddled with some issues there, and you need to be able to, your tool needs to be able to handle that. We certainly will be judging against a robust set of test data, and the plan is also, while we've provided you with some basic test data, the plan will also be to provide you with some additional, more robust test data in the future. Can the tool be a browser-based solution similar to the current XSL renderer? Again, I will bring that forward to the project team. Can we expose our tool publicly after the challenge deadline is passed, but before the September meeting? I don't think we have any, I'll ask the project team, but I don't believe we would have any way to prevent you from doing that. So that very well could be done. Can you describe the test scenarios the judges will use? We actually want to keep those a bit private because we want to make sure that people develop the tools based on the knowledge they have of C-CDA and the areas and the document types we're focusing on. So, so at most we'll give a high-level description of the test scenarios, but we won't be giving specific test data. Can we use our own test data to show the full capability of the rendering tool? By all means, yes, you can. And then there's quite a long question here. Is it okay to use languages besides Xslt? Yes, I believe yes, there is, but I will ask the project team about that. We have one about hospitals and clinical offices have very tight restrictions on access to websites and installing software. How will that be addressed? My understanding is that it will be open source and you would not have to, ideally you would not have to install any software in order to utilize the rendering tool. A question here was, is test data provided so every tool is rendering the same set of data, or participants provide their own test data? We have provided you some test data. We will provide you more additional robust test data. So yes, the answer is kind of yes to both aspects of this question. We are going to have, the tool can render the same set of test data, but you can also, use your own test data as well. Is this only a viewer or also an application with a database? I'm going to take that to the project team. I believe it's only a viewer. When you said the project team, did you mean the judges? No, the project team currently is comprised of HL7 staff, C-CDA experts, and ONC representatives. We're only bringing in the judges when we're ready to do the final judging on the tools. Can you give us some examples? What innovative tools do you expect as an outcome? Unfortunately, I cannot. I'm not familiar enough with, the development tools and that type of thing. I can bring this question to the project team, and we will. I'll see if they can come up with some examples for that. Can the tool be a desktop application that users can download? It certainly can. I kind of addressed that before with the, hopefully we don't have to download too much information with the tool because of, the various companies' restrictions on downloading. So this gentleman was interested in understanding exactly what the solution must be certified means. And I need to go back on that, and I will answer that and get back with you on that because I'm not sure where you're referring to that offhand. So the next question is, does the ease of integration of this tool into existing HIT systems, e.g. by a simple API, factor into the judging? And I believe that there is a FAQ out there about integrating with other systems. And if I recall, the tool does not need to integrate right away. However, the ability for it to integrate is definitely a plus while judging all the tools. Who are the target users of the tools? Clinicians only, or perhaps patients too? Primarily clinicians. Is the competition limited to U.S. participants? No, not at all. It is open worldwide. One person asked examples of the tools would be great. I'm not sure exactly what that question is, so if you want to email me that, I can bring that towards the project team and ask them to expand on that question. So then there's a rendering one C-CDA versus rendering multiple C-CDAs. With multiple C-CDAs, one may want to show how data domains can be aggregated across multiple sources, e.g. allergies, medications, and problems. I will take that to the project team because I definitely, oh, there's more. One may want to show how data domains can be aggregated across multiple sources. I definitely will take that to the project team because that is more depth than I know. How will you judge security of the tool? That is a great question. Let me bring that forward to the project team, and we'll discuss on how best to address that. So, and I apologize that I can't answer all of these questions offhand, but these are great questions that we can work on and actually, as a group with my C-CDA experts, be able to come up with some answers and be prepared as best we can for the submissions and going forward with this. So that pretty much ends the webinar. It was, this is the Q&A here. I appreciate everybody who asked some questions. And be sure to keep on going back to the website and finding out the answers to those questions as we as the project team comes up with them. So I can actually send out the list of questions that were answered or asked here. I won't have answers for them, obviously, not until the near future, but we certainly can send out that as well as a link to the recording. So I appreciate everybody for coming and expressing just what Steve did. Thank you for your involvement in this tooling challenge. It's exciting. It'll hopefully be fun for everyone and a great learning experience. And thank you all. Have a great day.